going to begin working on the posterior side of the body, doing a back routine. I'm going to show you the basic strokes of all the effleurage first, and then we'll go into friction, petrissage, vibration, tip-oediment. Any sequence that you would want to put these together is totally fine. Just remember in threes. Would you be able to do all the strokes? If you were having like an hour and 30-minute session with your client, then you could do every single stroke. You learn to pick and choose the strokes that your client needs, and that's where that intuition comes into play. So what we're going to do is we've turned her over now. You're going to recenter with your patient. So you place your hand in the small of their back and right here at their neck area. You have your patient take 3 good deep breaths. I like to put a little what we call Traeger from Dr. Milton Traeger. It's just like a little movement to it as I'm centering with my client. Now I just take this one towel out of the way and I undrape my client. It's very important that you don't bunch all your material here. You just basically bring it back and away from the body. And then I like to take my towel and drape it over the glute area. This actually helps hold the materials down whenever you go to work on the glutes, and we will be demonstrating the glute work as well. Here I have maintained my contact with my client. So now I'm going to apply my oil. Make a little boat in your hand. Warm up your oil so that you're not directly touching your client with cold oil. And you're going to start off with your shingling effleurage. This allows you to apply the oil to the body. So you're just shingling down the back. Applying your oil. I like to start off with what we call the butterfly stroke with occipital pull. Your hands are on each side of the spine, locked into the lamina groove and the erector spinae. Push in, making sure that you're breathing as a therapist too. When you're short like me, take a step up to your work, and you make what we call butterfly wings. Make them all the way up the body, all the way outside the arm here, around the traps. You come right into the sides of the neck up here, right into what we call the occipital pull. You're pulling right into here, locking in your fire fingers right into these occipital points here at the top of the neck. You want to do this stroke 3 times. Breathing therapist. Using your proper body mechanics. Then this is called butterfly stroke with occipital pull. I want to come back to that nice shingling again to just kind of warm the body some more. Shifting your weight, using your body mechanics properly, taking it all the way down to the top of the iliac crest. You can come around and change your body. Go back up the body. This is what we call that universal stroke. When in doubt, effleurage. This is your transition stroke, your shingling stroke. This allows you to transition anywhere on the body you need to be. And your client, staying nice, firm, deep pressure, feels like they have 1,000 hands on them, not just 2. Your next stroke that I'm going to demonstrate is called your V stroke. Your hands are placed like a V. You come down the body and off the iliac crest. Then come back with a nice nerve stroke. Again, straight down the body, off the iliac crest, and a nerve stroke back. You can shingle to transition yourself around to do the opposite side. Nerve stroke back. Next stroke I'm going to demonstrate is called your bilateral tree. Your hands come each side of the spine. You come all the way down as if you're doing the butterfly stroke, and you just make what we call tree branches. A little nerve stroke back, start out another tree branch, nerve stroke back, and another tree branch with a nerve stroke back. Again, straight down. Nerve stroke back. Next stroke is what we call hand over hand. Your hand is just placed one hand over the other. You come straight down the back, off the iliac crest, and the nerve stroke. Straight down the back, off the iliac crest, and the nerve stroke. And what stroke do you use to transition? Effleurage. Hand over hand. Right off the iliac crest, nerve stroke back, and over again, off the iliac crest, and nerve stroke back. I'm just going to position myself around the body so that we can do what is called open fist. Your open fist, the hand placement is very important. I see so many students do this number and torque their wrist, or they're doing this way and torquing their wrist. It's very important that you keep a straight wrist, and an open fist move is in this position. Your thumb is just as a guide. Your pressure is actually coming from right here on your hand. It is so important that you're staying straight wrist. If you don't, you tend to do this, and you're going to cause yourself problems as a therapist. So your hand needs to stay straight far as the wrist is concerned. You lock into what we call the lamina groove. This is the erector spinae coming all the way up. You lock your hand right into that erector spinae area, that lamina groove, and you push in, doing this open fist. And you make 3 passes so that you're following all 3 sections. And you come up to the top, do a little nerve stroke, and sink in again, just over just a little bit. So you're getting all 3 areas. And you're taking it in nice and deep. Nerve stroke back. Sinking in one last time. Nerve stroke back. Then what you would do is shingle around the body to transition yourself to the opposite side. And shingling is a dance. So think of swaying your hips, moving your hips, walking, working around the body. Again, straight wrist, sink in nice and deep. Lunge towards your work if you need to. Unless you're really tall, then you don't have to. I come up on my toes even. And nerve stroke back. Sink in again. And your thumb's just hanging out here. It's not doing any work. The work is coming from that open fist move. Nice straight wrist.